Yes, yes. It's only after the age of 35, and it's a very small amount of wine. It's 5 ounces. And any more than that, you lose the health benefits. It's a very fine line between health benefits and detrimental to health. Very, very fine line. Not something we want to advocate for.
And 35 is a long way.
Right.
35, yes. It's red wine. It's 5 ounces, and it's only after the age of 35. Yes. And if you're having more than 5 ounces, then you're in that gray area there.
Most of the literature I read said it was 10 per minute.
What, 10 glasses?
No, 10 ounces.
10 ounces. You know what? I think you got me there. I think you're right. Women is 1 glass of wine. I believe men can get by with 2 glasses. You're right. Okay. You can have 2. But no more. That's it. Then you're cut off. All right. Now guess what? Oh, okay, we still have the DASH diet. And this is the greatest reduction in blood pressure, the DASH diet. And again, we're seeing the whole grains, the fruits, and the veggies. And again, this is challenging for our lower income because it's fresh, again, and it has to be eaten right away. And then there goes your groceries until payday. So we have to keep that in mind when we're talking to people. And this is a lifestyle change. This isn't something that we can do sporadically. We can't do it once a week or once a month or when our blood pressure is high. It's a lifestyle change. It's something you have to do, you know, once you start it, you have to keep on it. This is a study by Keir in 2015, and they found that people who are active participants in their own health care have greater satisfaction, lower health care costs, and better outcomes. And home blood pressure monitoring is a perfect example of patient-centered care. This is something that people can monitor and they can know their numbers. And we ought to know our numbers. We know our weight. We ought to know our blood pressure numbers. Very important. Here we go. Pop quiz. I don't want anybody's blood pressure going up. The points don't matter, and we know all the answers. So what does the acronym PCOT stand for?
Observation, compare,
right?
outcome, and time.
Very, very good. Yay. Okay. And how many Americans have hypertension?
1 in 3.
1 in 3. That's a lot. That's a lot of people. We can do better. We can definitely do better. 3 risk factors unique to women. Pregnancy-induced hypertension, the use of birth control pills, just being 65 and menopausal, although I will argue with that.
Fat, fertile, 40.
Yes, you got it. That's it. What hormone plays a role? And that's the estrogen. That's the estrogen. And just one major guideline for the use of automated devices.
Upper arm. The
upper arm. Oh, awesome. You're amazing. If it was up to me, everybody would get A's.
Say it again.
Everybody gets an A. Everybody gets an A. Okay, I'm going to quick demonstrate how to use these automated devices. I'm going to do this one only because it's mine and I'm used to it. And ideally, I would have a sphygmomanometer with me. One of the best things we can do for anyone we know that's using one of these is check it from time to time. Check it and make sure that it's right. Make sure that it's calibrated. There actually are international standards and protocols in place for these devices. I believe the website is www.dabi. These standards were developed by organizations in Europe, but they're international standards, so they count. So every now and then we want to check it. And what are some things we might tell somebody that hasn't used one of these before? Let's say we have a girl, I don't know, let's name her Tammy, and she's 27, 28 years old, and she has a 1-year-old baby, and she had pregnancy-induced hypertension, and she's gone back on the birth control pill because she doesn't want to have any more kids. She's in college, and she works at Walmart, and she doesn't know anything about systolic or diastolic. What do you think the first thing we should tell her? What's systolic and diastolic, right? Because if somebody doesn't know and they see this, well, I don't know what that means, okay? What's my pulse supposed to be, right? So we want to explain that to them first off. You know, it's systolic, of course, that's when the heart is contracting, and of course the diastolic is in between the beats when it's filling the blood. It's the rest period. And the pulse pulse should be between 60 and 100. Well, that's something somebody might want to know. And then what we want to teach people is to rest for a minute.